Rett syndrome is a disorder characterized by unique, diverse, and complex clinical manifestations. For that reason, in order to know their impact on affected individuals and their families, it's important to do focused research in this area to see to what extent the clinical manifestations of Rett syndrome have an impact on quality of life of individuals and their families. And this is the project that I'm presenting now. The first analysis is labeled as a study of burden of illness of Rett syndrome, which is essentially impact on quality of life. And it was a community effort, a collaborative project involving multiple stakeholders, beginning with caregivers, advocacy organizations in the US, United Kingdom, Italy, Germany, and Australia, clinicians and investigators in those countries, and industry partners. The data was collected with support from Neuron Pharmaceutical and with assistance from Parexel. And the data has been maintained, managed, and analyzed with support from Anavex Life Sciences Corporation. In addition to thanking the participating families and clinicians, without them, this could have been possible. A special thanks to Steve Kaminsky, the Chief Scientific Officer of IRSF, for launching the project. The objective of the project, as I mentioned before, was to evaluate the impact of the symptoms or clinical manifestation of Rett syndrome on affected individuals and their caregivers. In particular, to identify problems with high impact, to determine whether they impacted the same way affected individuals, the patients, and their caregivers, and to examine the relationship between the problem severity and its impact. The way that this was carried out, it was mainly by a caregiver survey, and aligned with that was also a healthcare provider survey, and these were developed using conventional methodology, literature, and also input from parents of children and adults with Rett syndrome. The survey focused on 21 major clinical manifestations in Rett syndrome, which were grouped in 15 domains or categories, and they were mainly scored in a scale of 1 to 5, with 1 being the lowest level of the severity or impact, and 5 the highest. And healthcare providers evaluated only severity, while the caregivers' severity and impact. This was a large study involving 756 caregivers, mainly parents of children with classic Rett syndrome and MECP2 mutation, who were the majority of the cohort, and clinicians, 112 from the country that were mentioned before. The statistical methodology is conventional for this study and include, in addition to descriptive statistics, chi-square test, which examine the relative proportion of answers each one of these levels of severity or impact and how they relate to each other. This graph is to show you an example of how diverse is the impact of symptoms, or in this case, on caregivers. These are 3 common symptoms of Rett syndrome. In blue, hyperventilation; in red, dystonia; and in yellow or orange, nonverbal communication. As you can see, they are distributed differently. You see much more blue on the left, from the center to the left, meaning that it has less impact, hyperventilation. In the middle, you have the reddish of dystonia. Most of the answers are centered around somewhat, which is the mid level of impact. And in contrast with this, the nonverbal communication is skewed or distributed more toward the right, meaning that it has a higher impact on the caregivers. So which problems or which clinical manifestation had were the most impactful, had the greatest impact on affected individuals and caregivers, were those related to the core features of the disorder. By core feature, we refer to those symptoms that are the one used to make the diagnosis of Rett syndrome, are distinctive characteristic. And those are communication impairments and fine and gross motor impairments, such as ambulation and hand function. And that's where you see the greatest concentration of 4. This table presents the data in a different way than the graph. The percentages that you saw before are grouped in 4 quartiles, meaning if the percentage was 0 to 25, it's a 1. If the percentage were 75 to 100%, were a 4, and in between 2 and 3. So when you see a lot of 4s and 3s, is that it has high severity or high impact. And that's what this red frame is highlighting here. Now, the second question is, who is most affected? And even though the impact on affected individuals and caregivers was high for many symptoms, for a group of them, it was greater on caregivers. And that those symptoms that have that profile are highlighted in the larger rectangle, and they tend to be symptoms that have episodic characteristics. And those include seizures, abnormal behavior, sleep problems, and pain. And in addition to that, we examine what the relationship between problem severity and impact. And you can see, particularly in the lower part of the table, there are many severities that are 1 or 2, and they have higher numbers in terms of impact. And this is both for individual and caregivers. And this is what we identify as the main finding, that even mild to moderate problems have high impact. And this is one of the main outcomes of this analysis. So we can conclude that even mild severity impairment can place a disproportionate burden. In other words, they can have high impact, can affect quality of life of both affected individuals and in some cases, even more caregivers. Why this information is important? Because this information will help to develop and evaluate existing treatments. These treatments and care for patients with Rett syndrome should be guided not only by the clinician impression of severity of the symptom, but also by the impact that these symptoms have on the patients and their families, what really matters to affected individuals and their families. This was the first analysis of this data, and therefore is a big picture view, an overview of the data. We cover the entire age range, so we need to examine in the future whether this relationship, these findings are the same in younger individuals or older individuals, whether the clinical type, classic Rett syndrome or atypical, has an impact, and particularly whether healthcare services have a role in these profiles, in the impact of these symptoms on individuals and their families. It has been a particularly gratifying project for me to participate because it represented a community effort in obtaining this very important data that can help to improve the quality of life of affected individuals, patients with Rett syndrome, and their families. Thank you.